Welcome back to HealthWise with our special guest, Dr. Gros. Dr. Gros, we were talking about arthritis. You kind of mentioned it and touched on it a little bit. Isn't there a special procedure that y'all do specifically, usually with arthritis?
With spinal arthritis, there's several different techniques that you can use. Arthritis has been around forever. As long as the man's as long as the man has done work, there's been arthritis.
Right.
Specifically, spinal arthritis.
Can you explain to our viewers like what exactly it? Because I know everybody knows about arthritis, but I don't think they actually know what it is.
Right. Arthritis is a fancy word for inflammation of a joint. The spine is no exception to the rest of the body where two bones come together. A lot of times there's joints. These joints in the spine have a fancy name called zygapophyseal joints, and they're more commonly called facets.
Okay.
So if you go to your doctor and you hear the word facets and arthritis, and that's what he's kind of talking about. You're starting to develop some arthritis in the little joints between the spine bones. As this inflammation continues, the inflammation caused either by just chronic wear and tear. Obesity is a big culprit for causing facet disease for long term. Acute trauma can cause it. And then there's also some people who are just genetically predisposed to arthritis. With these particular patients, the goal is to decrease the inflammation, as the inflammation not only wears down the joints themselves, but the inflammation itself can cause pain.
Okay.
So the whole goal is to decrease the inflammation initially. So that can be done sometimes by epidural steroid injections, and if the patients don't respond, we sometimes do injections directly into the facet joints themselves, and the steroid there can sometimes cool the inflammation down, and patients get really good results that way.
Okay.
If the patients don't get great results, but they get pretty good results, then we may actually block the nerves that go to that joint. So although it doesn't cure the arthritis, you don't feel it.
So the arthritis is there, but it's just no feeling. So you're fooling the body.
You're fooling the body. There's no pain.
Fooling the brain.
Correct. The arthritis is there, the pain is there, but the signal never gets to the processor.
Well, and what's that called when y'all do that?
Well, those are just pain blocks, and of course, if the patient responds well to those, then we do something called radiofrequency ablation. RFA is a really cool technology where you can actually burn the little nerves by a heated needle tip that is introduced through the skin. It is done in an office procedural setting, which is basically at our pain clinic.
Okay, so it's outpatient. Really,
Correct.
Really easy to do. And so you're actually burning the nerve endings to where they're not there anymore. So you don't have any nerve endings. So without nerve endings, no nerves, no pain.
That's it.
Right. Okay. I guess there's some scarring, I'm sure.
Actually, the scoring is all internal, because the only thing you have is a small needle entry point in the back. For every facet joint that we address with this procedure, there's two separate little injections, because there's a nerve from above and a nerve from below. So the external scoring is very, very minimal. The healing process is addressed with a short-term course of pain medication as needed after the procedure, but most patients tolerate it very well.
Okay, that's something but that's new. How long has that been around? How long?
It's been around for a while.
Oh, really?
But it's something that, again, this is something Dr. Wobble and I had decided, hey, our patients are leaving. Our people here in Opelousas are leaving, going other places to get it done, because there was limited offerings in this area. So we decided, hey, to expand, and we're going to make Opelousas a little bit better for everybody.
Okay, so yeah, so the I don't know if you call it turnout or the amount of people that are getting this, is it growing? You know, it seems like it is, and it's catching on.
Absolutely, and part of it is due to education of patients, education of primary care physicians about this as an available resource. So we've limited a little bit our primary care referrals, but for the most part, we get a pretty good turnout. Most of the referrals that we get, we've had really good long-term relationships with these physicians. They're all local physicians in the area, and they've gotten to understand the disease process, and I would say awareness was the biggest reason that the numbers continue to increase.
Okay, Doc. Well, we're going to take a brief break, commercial break for our sponsors, and we'll come back and talk some more about pain management options here in Opelousas.